Hi, I wanted to talk to you about plug ducts and what's the difference and what we can do with these plug ducts, because plug ducts mixed in with sore nipples is a setup for mastitis. And so plug ducts, best thing we can do with these plug ducts is, of course, empty the breast enough. And what helps is if you have a plug duct up here, then we want this baby up as high as possible. We almost want the chin to be where the duct is and where the hardness is. And so if you have a plug duct up here, it's almost like you can have the baby over the shoulder. Yes, ladies, we can nurse our babies with the babies over the shoulder. I wish I had a picture of it. I've done it with several of my clients that way, and we've gotten the relief that we wanted. So you might need to be laying flat and having your partner help you with the baby and see if that helps release the plug. The other thing is, I'm a big fan of lecithin, L-E-C-I-T-H-I-N. I believe I'm spelling that correctly. It's at any over-the-counter pharmacy, Target, Walmart, any place, any grocery store, wherever the vitamins, the supplements are. It's a food supplement, so it's already in our cold cereals. And you're going to take it as directed. It will say take with 1,200 milligrams 3 times a day. And with a meal. You don't necessarily need to take it with a meal, because it's not going to upset your stomach, but it will enhance the food that you are eating, the nutrients and whatnot. We have found that lecithin reduces the stickiness in a breast, so you won't have those plug ducts. I have to have clients on lecithin always, you know, the whole time that they're nursing, so a long time. So just want to make sure that that's clear in case you might be one of these moms that have chronic plug ducts and chronic mastitis. Now, when we have chronic mastitis and chronic plug ducts and whatnot, it means something's wrong anyway, and it's usually a poor emptying of the breast, and so it's other issues, and lecithin just becomes a band-aid, but boy, it works. So. And what else can I tell you about plug ducts? Plug ducts also is really, a lot of moms will need it and like, come on, you're getting out and making it soft, and that's going to just cause more trauma to the ducts. We don't want that. We want to treat your poor duct and your breast with tender, loving care. Lots of love. And so I just want light stroking massage in that area while that baby is nursing. And again, positioning is everything. We also want to make sure that baby is draining. If that plug duct goes away after a feed, then we kind of know it's on a little bit on the normal side. And just watch it and love it and keep massaging it and keep draining it and pushing that milk towards the nipple so it can fully drain. I'm going to give you a trick that I have used for some of my moms. For those of you who have chronic plug ducts, and it's not a lot of research based, but boy, girl, does it work. And that is an ultrasound machine. Yes, an ultrasound machine that it wasn't necessarily the one that we need to check to see if your baby's heart rate is okay, but it's sort of the same. It's a therapeutic ultrasound. So we would see it in the physical therapist's office, and it just so happens that Dr. Christina has an ultrasound in her office here at Family First Chiropractic Wellness Center. So she doesn't charge very much for it. It is $15, and we allow you to do it. It actually is even out of my scope of practice to do that, but we teach you how to do it, and we have the machine, and it will release it, and you use the gel and you massage the area of that plug duct for about 10-15 minutes, even though the few research says only 5. I'm like, if we have the option to have it be there and the machine's working, I see much better results if we do it for 10 to 15 minutes. Have that baby nurse or pump afterwards if we don't have a baby nursing well, and it's going to release, and moms feel like dynamite. They feel so much better to get rid of that painful plug duct. Again, with plug ducts, you can use heat because we want, again, love the breast. We want to love it, again, with tender, loving care. And I'm sure your husband would want you to do that too. And the other trick is what we've done is the shower can be helpful in this case because it's kind of allowing a little bit of that massage and that stimulation on that plug duct. The other thing is that you can put your breast in a warm bowl of water and soak it. So you're going to soak the affected breasts, if they're both great, put them both in this big bowl of water, and you're going to kind of lean over and just let it soak. And then right afterwards, you're going to do a little shimmy. Shake, 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 shake. And it will help release also that stickiness in the breast where that plug duct is, so we can let things move freely and flow nicely, so we can get you breastfeeding pain-free. Another option that might help is essential oil of grapefruit. For those, again, that are into doTERRA, I know I have them. I have access to them. I don't usually sell them, but I do want people to be aware of the benefits of some of these. So again, if you want some and need some, I am happy to provide you with some of these essential oils that you might need. So grapefruit actually helps with the flow as well, so that might help. So grapefruit smells good, it will make you feel better, it lifts your spirits, and you can't go wrong with having an oil that's going to make you feel good. And just a little tip, grapefruit also can help you lose a little bit of weight, that baby weight. So just a little plug for that. What else can we tell you about plug ducts? Again, not wearing real tight bras. We don't want to have a restriction there. But yet we do want a nice firm bra. And we want to just, again, make sure that things are just being treated well. Think of nice softness, and that will help. Now, if you have mastitis with this, and you're going to know you have mastitis because you're going to have a fever, and you're going to actually feel like crap. And you feel like you have the flu, you feel like you're going to die, you have a fever of 101.5 plus is a true mastitis. However, you can feel like crap and see the red mark on your breast, and that is an emergency situation. So we can do a couple of things with that. We can either, if we catch it in time, get your butt to bed, girl, and drink lots of fluid and nurse and nurse and nurse and nurse and nurse. Now, this is only if the fever hasn't caught up to you. So if you don't have a fever yet, we might be able to reduce that by going to bed and taking care of yourself. You've just overdone it. And again, completely keep your breast drained as much as you can, and that will help. Now, if you find that the fever has hit you, it's time to call your doctor or your midwife and get a prescription for, I believe the medication is doxycycline. And there is a protocol. A lot of people are like, well, how do I treat it? Doxycycline, K-Flex, and then there's oh gosh, I can't think of the other one, but it starts with a C. If you go to American Academy of Breastfeeding Medicine, there is a mastitis protocol, and there it will list the antibiotics that you are to use. Some women are leery to use antibiotics when they're nursing, and they're absolutely safe. So little medication gets through the breast milk, and we wouldn't be suggesting this if it was going to cause harm to your baby. Now, if you're going to be on antibiotics, what I do want you to be aware of is a possible thrush. And so what we can do to combat that and to prevent that is lots of probiotics. So not just yogurt. I need a good stuff that you're going to get at the health food store. And then also they make them for babies. Because if you have mastitis, your baby has mastitis. And if your baby has thrush, if you have thrush, your baby has thrush. And if your baby has thrush, you have thrush, whether you have symptoms or not. Usually one of you have symptoms, and mom's usually the one that will see the most. And it's shooting pains up in the armpits, burning nipples, almost like someone is lighting a match at the nipple site. It hurts. The letdowns hurt extra bad. And your baby could have a red diaper rash or could not. You might be able to see the white patches in the mouth, or you could not. When in doubt with your baby, if you get a wet washcloth and wipe the sides of the mouth or where you see the white patches in the baby's mouth and they don't come off, that's probably yeast. If it does, it's milk. And thank goodness there's not a yeast issue going on. So probiotics, go to bed, treat yourself with loving kindness, lots of water. Drain, drain, drain that breast. We want you to keep feeding the baby. And also a really important situation that does come up with women who have mastitis is that their milk supply can drop and dwindle when they are having bouts of mastitis. So don't freak out. It will come back. It always does. I promise you. But it may take about 5 days, 7 days sometimes to get that milk supply back where it was before the mastitis hit. So just make sure that your baby's getting enough to eat, and if your baby's still pooing and peeing and seems to be okay, then you're good. The milk will come back, and every day is different with our milk supply anyway. Some days we have a lot, some days we need some help, but the baby's going to do its job and be able to get what he needs, and you're going to be just fine. So love yourself and take care of yourself at this time because you need it. Get a meal coming in, get your mom to come over, get someone to rub your feet. Oh, and another tip that I can tell you, I'm so excited. There is, when you are engorged or have a plugged duct, I want you to do some tapping. So you're going to find your sore spot here or here and just tap, 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 tap. And tapping that is also going to release the tension that's going on in your breast. Also, it's a little bit of an energy therapy technique, part of EFT, emotional freedom technique. And so just imagine when you're tapping that everything's releasing, everything's fine, reducing the stress. Also, getting a back massage from your partner. So what you're going to do, go at the V line, right behind between your shoulder blades. And he's going to massage while you're nursing, while you're pumping if you need to at this point to release things. And that way, things are going to feel so much better. You're doing a great job. It's not always like this. And it's not going to always be painful. And it's not going to always have one hurdle after another. They will go away. And we only know when they don't go away. No matter what we do, we need some more help. And we need to be able to get you on that right track. So have, again, love for your breast. Love for yourself today. Take care.